I think in my practice of people that are sick with chronic exposures to toxins and toxic experiences like stress, that at the very top of the list of underlying root causes, I would have to say is a group of molecules that together we call mycotoxins or mold toxins. And they're a finite number of molecules. I think in science we know of approximately 30. And it turns out that when people have these toxins within them, they can act as pretty dramatic root causes of many of these signs and symptoms of illness that people come in with. And because of how common it is to be exposed to indoor mold, this is probably at the top of the list of factors that cause people to be sick in my practice. Now, I would say that, people that come in, many of them already perceive that they're sick from mold illness for one reason or another. Perhaps it was because they themselves noticed that it was on exposure to obvious indoor mold that's when their symptoms started. Other times it might be that they just had symptoms, and because of testing that somebody else did, they were told that it was likely that cause. So it's various ways that we find out, but typically for me, it always starts with a really thorough history with the patient. And I always like to start with, when did you first notice either your symptoms begin, or in some cases, it's just when did your symptoms significantly worsen? Because a lot of my patients will have had some sort of underlying smoldering symptoms, and then they jump to a whole new plane that often correlated with a specific exposure like mold. But we're typically talking about indoor molds, because the indoor molds are the ones that are way more likely to give off some of these 30 toxins that we refer to as mold toxins. And I always tell my patients, it's actually, molds never did intend to make humans sick with their mold toxins. Mold toxins evolved to make these toxins primarily to compete with other molds and bacteria for the foodstuffs wherever they're trying to grow and live. Like, for example, a water damaged building, say under a wet floorboard or behind a wet sheetrock wall, or even a mattress, something of that nature. So yeah, that's how we come by indoor mold, and that's where the mycotoxins are. I also like to explain to my patients that mold, the pathogens in the group that we call molds, which also synonyms might be fungi and yeast, that not only can they give off these toxins, like in the 30 group of toxins, but also in some cases, these funguses can cause life-threatening infection. For example, a person that has a suppressed immune system, if they get infected or colonized by certain species of molds, they could actually die from a very vigorous and rapidly progressive infection. Now, fortunately, that's very rare, and I almost never see that in my practice. But also, pretty common to see is people who are allergic to mold. And that's typically different than people that are reacting to mold toxins. People that are allergic to mold, basically, when they become exposed to mold by breathing it or eating it or what have you, the immune system recognizes it and responds in a way that causes an immune reactive response, which we could call allergy. It might be through the release of histamine or other immune mediators of inflammation that give rise to some of the typical allergy symptoms that we've come to know, such as congestion, itchy eyes, runny nose, sneezing, tickling throat, postnasal drainage, even tightness in the chest, wheezing, sort of the asthma symptoms. But histamine can also cause other symptoms such as mood changes, fatigue, sleep disordered symptoms, and generalized aches and pains as well. So, yeah, that's mold allergies, and that should be differentiated from mold toxic illness. But I will say there's often overlap. People that are toxic from mold exposure and the mold toxins may also have a lot of symptoms of mold allergy. Yeah, there's actually about 30, and typically we can test for a handful of those. One of the better ways to test is by collecting a urine sample and then doing a very fine determination of even tiny, tiny levels of these mycotoxins in that sample, usually urine. Um, some of the more common ones would be ochratoxin, aflatoxin, gliotoxin, mycophenolic acid, trichotillin toxins, citrinin. But there even clinically, we measure probably altogether about 15 or so of these 30 that are known. Different mold toxins also cause different problems. Some of them are more specifically toxic to certain cells and certain systems, or even to the mitochondria. So different mycotoxins might be more likely to cause kidney problems or liver problems or brain problems or immune system depression problems. It kind of depends on the toxins involved. They are very similar. The symptoms of mold toxin exposure are actually very similar to the chronic environmental symptoms of illness that people get from other forms of toxic exposure, including things like COVID-19, chemical toxin exposure, heavy metal exposure, electromagnetic radiation exposure, even toxic life experience exposure. But I would say for mold toxins, um, fatigue is very high on the list. I would say disorders of cognition, which together we normally like to call brain fog. That's a term that people really relate to, and they tend to really be able to track the degree. And it's also in the world today, it's one of the most problematic symptoms for people to have when they can't perform their activities of daily living because of their brains just don't function right for them. There's a lot of mood symptoms that we see in that group. There's a lot of digestive symptoms that we see related to mold toxins. And I believe that that's because we typically breathe in the molds that have the toxins on them, but then they're often swallowed because the spores and the toxins that stick to the linings of our nose often then are swallowed back into our esophagus and later into our intestinal tract, where they then can cause a wide variety of digestive symptoms. But I used to practice otolaryngology, and one of the big problems that we treated was esophageal reflux, even affecting the throat and the voice box. Today, I know that people that have never had any symptoms of reflux and suddenly develop symptoms of reflux that's bothersome, I often immediately ask and think about mold toxin exposure because it's very frequently one of the bigger causes there. But then also you can have patients that will complain of bloating or diarrhea or constipation or post prandial pain, pain after they eat. And there's some other symptoms of gut health disorder that we see from mold toxins. Yeah, because of these toxins and the way they interact with cellular elements, they can actually lead to significant cell dysfunction. Mitochondrial dysfunction is real common, which of course leads to an energy deficit on the part of the body, because that's where we get our energy. The other thing that happens with damage from mycotoxins to the mitochondria is that it causes generation of excessive amounts of what we call reactive oxidative species. Some people call them free radicals, and these cause what we call oxidative stress. So that tends to be kind of an underlying common theme of the effect of mold toxins. Also, the mold toxins have a tendency to cause the brain to perceive that we're not safe. And then when that happens, there's all sorts of evolved reactive changes that threat brain causes, including upregulation of our senses, upregulation of our immune response. So this happens from mold toxins. We even know that some mold toxins will suppress the immune system. Some mold toxins can damage the liver, can damage the kidneys, can damage the blood forming organ, and even in some cases can lead to cancers. Some mold toxins over time we know can act as carcinogens. We see that all the time when people become ill and they have a reason to suspect mold. Sometimes it's because they've seen it, or sometimes it's because they've read about certain symptoms that they relate. Sometimes it's just because where they live has sustained a water intrusion event, which often acts as an initial factor to cause mold to bloom in an indoor environment. It almost always has to be associated with moisture, which is actually very common. But for a variety of reasons, the symptoms that they have, plus minus that they sense that they've had exposure, some people can immediately know when they go into a place that's likely to be more moldy that they will immediately sense certain increase in certain symptoms of illness. Sometimes it's because they've worked with other practitioners or even done self testing to show some of these mold toxins that are present. And so they have, in some cases, some laboratory evidence that mold is a problem for them. At Forum Health, when we see people that come in with the signs and symptoms of illness that may suggest mold toxicity, we take a very thorough history, again, focusing on the initial onset of symptoms, uh, other associated exposures, pre existing illnesses, any kinds of diagnoses and other testing that they've been given. And then based on that, we oftentimes will, after a physical examination, looking at some of the ways that mold can affect the body, we will oftentimes do certain tests to try to further identify the presence of some of these mold toxins. But sometimes, too, we will do assessments to try to determine what factors might be causing that individual to be more sensitive. It could be that they may have inflammatory markers that demonstrate ongoing inflammation. It may be that they have markers that show that they may have nutrient deficiencies. Um, Other things that ways that we can assess the body's terrain, which just really relates to their personal sensitivity. The reason that's important to check that and to think about that is because a person's personal sensitivity, say to mold, it doesn't have to be fixed and concrete. We know that it can often be modified for the better. And these are steps we always try to take to try to help a person be able to overcome those symptoms from the mold exposure. And then clearly, avoidance of any known mold exposure is pretty critical. I would say since mold toxin illness is most often, in my experience, comes from breathing mold toxins as opposed to swallowing them or having them land on our eyes. They're breathed in, and initially they often will stick to the linings of the nose, and then subsequently some of them may get access to the lungs or even be swallowed. Some of them they may be absorbed directly into the bloodstream or even gain access to the central nervous system. So a couple of things that come from that is I tell my patients that they can't breathe air that's too pure. And by that I mean if they filter the air or if they live in an environment that's very clean of airborne particles such as mold spores, that's only going to help. So clearly, I tell my patients that I don't believe they can spend too much money on good air purification. The other thing I tell people is that just the simple act of rinsing the nose out with a clean solution of salt water can be dramatic in terms of eliminating many of these toxins before they have a chance to be internalized into the body. And I sometimes joke and say, you know, if I was a doctor on a desert island and only had one treatment, give me saltwater flushes of the nose, and I'll be able to do probably the most good for the most people. with that.